So, good afternoon, all. So, this is a part of the good, replicable, and innovative practices in tobacco control in India. So, we are holding weekly sessions for you. And the topic today is Rose Campaign and Innovative IEC Institutionalization of Tobacco Control at District Level by Mr. Prabhakara, Project Manager. He's in Karnataka, Bengaluru. He's with the Vital Strategies India now. So I welcome Dr. Prabhakara, and the presentation I already told you it is about the Rose campaign. And I'm Dr. Rakesh Gupta, President and Director of Public Health Strategic Institute for Public Health Education and Research. So Mr. Prabhakara, as I told you, that he is project manager with Vital Strategies India, and he has got 19 years of experience in the development sector, handling national programs at the state level, like the National AIDS Control Program and National Tobacco Control Program. And moreover, he has got 11 years of experience implementing skill development programs for multi-target groups. And more than 11 years worked closely with government departments to implement national health program. And he has specialized in program management, capacity building, monitoring and evaluation. So over to Mr. Prabhakara. So we'll listen to his new initiative. Thank you.
Thank you, sir. Thank you. So, thank you so much, sir, for giving this opportunity because this is one of the important platform to share the good practices and replicable models with the public health professionals. And thanks for selecting me to talk this particular topic because the Rose campaign is a brainchild of me. And we started this, initiation, program in 2016-17 financial year. About myself, as sir introduced, I am from the Vital Strategies. Vital Strategies is one of the technical partner organization for Department of Health and Family Welfare, Government of Karnataka, to implement the National Tobacco Control Program in the state. So we are working with the Department of Health and Family Welfare since 2013 with the Bloomberg Initiative project. So I am handling the Bloomberg project from Karnataka. Uh, Regarding the background of this particular Rose campaign, as you all aware of that, so in India we are having a big issue. Not only India, globally we are having the issue of tobacco control, tobacco consumption. And as you all know, we in Karnataka we have 28% of prevalence in India. And if you ask me in Karnataka, it is around 22.8%. It means around close to 2 crores of Karnataka population is currently consuming one or the other form of tobacco product.
So,
Yeah, fine. So, key feature of this particular campaign is it is a single campaign reaching multiple targets. This is one of the speciality of this particular initiative or IEC post campaign. Why? Because we are involving the students community, we are involving the parents community, we are involving the teachers, and also local political leaders and education officials from the different departments, including education departments, media. So everyone is included and involved in this program. So this is one of the beauty of this particular campaign, Rose campaign. So why this campaign? You are aware of that under Cigarettes and Other Tobacco Products Act, Section 6B, prohibition of tobacco sale within the 100 yards of education institution is prohibited. But if you see the CODPA compliance report of any state in India, including Karnataka, the compliance of Section 6B is very, very poor. And tobacco industry is strategically targeting youths by its different marketing strategies. So they wanted to have a tobacco retailer shop within 100 yards or close to the institutions to attract the youth community and the students community. And you people are aware that if the current data says in India every year, almost every year, we are losing 13.5 lakhs people who are using tobacco. 13.5 lakhs annual death, which means tobacco industry is losing its customer, 13.5 lakhs customers every year. Now, what tobacco industry? Yeah,
Prabhakar, can you just ask me to change the slide whenever you want?
okay, okay. I'll just explain the slide number 2 now. Once required, I'll ask you, sir.
You want this?
Yeah, I want slide number 2. It is already visible.
No, the
My
key
screen.
features of the campaign. No?
Yeah, that is slide number 2. It's visible now.
Okay.
Yeah. So that is the intention of the tobacco industry. They want to replace its customer by aggressive marketing strategies, focusing on the youth community or the students community. So that's why we are, struggling to get the Section 6B compliance even after 10 or 11 years of tobacco control implementation. So which provoked us, which encouraged us to think of something else to get the compliance of Section 6B. Another background of this particular campaign is whenever we go to the enforcement of COTPA with the squad, the general arguments or the state from the point of sale owner is we are not aware of this COTPA. We don't know about Section 6B. हम लोग अनपढ़ लोग हैं, हमको ये पता नहीं. So this kind of statements we are getting from the point of sale owners. Though we are issuing the public notice from the authority regarding the COTPA conditions, everything, but the most of the response are same. So that's why. And the third thing is advertisement which I saw in the TV and theater. That is, father is coming inside the home with a cigarette, and the daughter's watching the anti-tobacco video in the TV, and the person is coughing and is getting health issues. With the feared eyes, the daughter is looking at his father, thinking that even my father is going to happen this kind of health issues. Then immediately the father throw that particular birds and he will hug his daughter. So it is that particular video which provoked me to think a similar kind of IEC campaign, and that is the result. Now we are working on the implementing the Rose campaign. I dropped the when I have written a concept note of Rose campaign, and I shared with my SMO and I shared with my principal secretary health, and we start implemented this particular Rose campaign in the first time in Udupi district, which is having 1,200 plus schools in particular district. So this is the background of this particular campaign. As I told you, it is a very cost-effective activity. You don't want much budget for this. A rose from the student can get a rose from his home, and a banner. And other thing is only coordinations and communication with different stakeholders. That's enough. So no need of huge budget for conducting this particular activity, and the multi-stakeholders involvement. So civil society, local political leaders, media, government officials, everybody's involved in this particular campaign. Sir, can you show me the slide number 3, please?
There's a slide you want?
We are in slide number 2. Can you move the slide to 3?
The tobacco-free education institution. No? I'm able to see that.
No, that is there is a one graph after slide number 2.
This is the slide number 3 I have.
We are in the key features of the campaign, slide number 2.
Now, this you have already told, no? The key features.
Yeah, yeah. Please go to next slide.
Okay. So this is the next slide. Can you see this?
No.
So I think there's problem with the presentation then. Okay. I'll try. I'll try again.
Yeah.
Is it okay now?
Yeah,
Yes.
now it's visible.
Now
Yeah.
it's okay.
Perfect. Perfect.
Your screen also.
Okay.
Yeah. The process what we followed is mapping of point of sales, mapping of tobacco institutions. I mean educational institution with point of sales within the 100 yards of educational institution. That is the first step we start. Then sensitizing the key officials. Why this section 6B is important? Why this code by implementation important? Why this tobacco free education institution is important? Then coordination with education department and health municipality, other people, saying that we wanted to create awareness program or a sensitization activity for the multiple stakeholders on the section 6B of the CODPA because the compliance of CODPA is very poor. Number two, we need to stop the new initiation of tobacco within the 100 yards of education institutions. And, we have to educate the students about the ill effects of tobacco. So with these three objectives, we met the, education department and other health department and municipality department officials. And we requested their support for the district-wide campaign on this particular rose campaign. And also discussed with the DDPIs, Deputy Director of Public Instructions, about this program, and they were thrilled with this particular, campaign concept note, and they have given their green signal to have a, district level program. And the later we went to the tobacco sellers also and wait them. So whatever the selling is happening within the 100 yards of education institution is that is illegal and it's a prohibited activity. So, but the people are saying they're giving their own justifications. And you are all aware of that what justification they're giving. So, and we made sure that media should be involved, because we want to maximum in a district level program can mobilize 1,000, 2,000 people. But the message should go to the each and every person, not only restricted to one particular district. It should go to the statewide. So we want statewide media news on this particular activity, and we have written a separate letter to the media by the Department of Public Relation and Nation Department. So, and district commissioner, I think the DC of the Udupi, she returned to the public instruction and information department of DD and asked him to give a wide publicity on the Rose campaign. And after the after that particular step, we have also collected the data on once we completed the Rose campaign activity. Again, we have done a survey, a simple survey with the help of education department, saying that how many point of sale owners stop their own after this particular campaign. So because how impactful on this particular IEC activity on the point of sale owners, and whether they have convinced with our campaign. The next step is enforcement drive, because we are aware that by doing some kind of a campaign, you cannot expect a 100% change. And we are completely aware about the what changes is going to happen. So our expectation is very simple. Number one, we want to sensitize the point of sale owner about the section 6B. Number two, they should not give any answer further saying that they are not aware of the section 6B. And third thing, it is easy for us to take legal action on them without any hesitation by the enforced authority. So these are the simple expectation of this particular program and the campaign. So that's why we told them after 15 days of the campaign, there will be a rigorous enforcement drive on the point of sale who are still selling the tobacco products within the 100 yards of education institution. So then declare by the education institutions about the uh, achieving the tobacco free status, and used to get monthly updates from DDPI of Udupi district to the district tobacco control cell Udupi about the progress of TOFI compliance. As I told you earlier, they had only 1,200 schools in the entire district. So, and strategically, we have selected that particular district because it is very difficult to manage a huge district, and it is very difficult to assess the outcome of the campaign. That's why we started with a good compliance, good DTCC functional district for this particular campaign. And during the quarterly review meeting, district level coordination committee meeting also, this particular activity was discussed, and the compliance of the TOFI was discussed by the district commissioner. So this is entire how we have structured this particular activity in a simple way. So next slide, sir. So I already told you, and the process what we followed is we are in a single day, entire educational institution of that particular district should come out on a particular time with the rows, with the small handbills, and with the local leaders and the department officers and the students, parents, SDMC committee, and they have to visit the point of sales which are selling tobacco within the 100 yards of education. And some of the schools and schools, they have involved NCC and NSS people also with bands and everything with the uniform. So students done a jata, and they have sensitized the sellers within the 100 yards of education institutions. And students made the appeal to the seller with the very emotional letter or a small handbill which says a single cigarette has more than 1,000 plus chemicals, out of which 28 are carcinogens. In case if your daughter or a son asking for BD or cigarette in your shop, will you give to them? No. Then why are you selling this tobacco? Why are you selling this poisonous product to us? So please don't sell tobacco within my school or premises. This is the message which we have written in Kannada, the regional language, and we have shared. We have the student has to give that handbills to the point of sale owner with the single rose, with the flower. It is kind of giving a respect to the point of sale owner and conveying our request by the student. And another important logic is, and the thrilling point here is, most of the point of sale owners are their students relative, or maybe their father, or maybe their brother. And because there is no person who external person coming inside the city and selling tobacco, the most of their own family members. So that, so for example, my son is requesting me, and he's telling, Papa, don't sell tobacco in my school. So that is very effective. That message makes very, makes more emotional. So don't take it as a legal point of view. It is an emotional requesting and appealing by the students. And other side, it is a reflection for the students himself or herself, saying that tobacco is not good. This message were inculcated. And the third point is, children is asking her parent or his parent, saying that, माँ, कल हमारा स्कूल में रोज कैंपेन है, मेरे टीचर ने बोला ये एक फ्लावर और रोने के लिए. So then immediately the parent will ask, why? What is rose campaign? So the child will give his own answer and explanation about the rose campaign. Ill effects of tobacco to the parents. So this is a kind of dialogue, continued dialogue between the different stakeholders. That makes very powerful and effective. That's the idea of rose campaign. And so we have, after that we have also done the quick survey to assess the compliance. Next slide, sir. So these are the glimpse of rose campaign, and you can see the political leaders, you can see the officers, you can see the teachers, you can see the students, you can see the public in the campaign in the jata. So, and there is a small banner in Canada, which talks about rose camping. And you are, and there is a huge program in one of the district called Bangalore Rural. And in the first slide in the picture, you can see the district commissioner. She is standing in the stage and motivating the she's inaugurating the rose campaign program in Udupi. So the lady in the first photo, she is the district commissioner. So, and the DDPA, everybody was there, and the student, and the placards. You can see the placards in the next picture. And now student is carrying the flowers and giving to them, and people are watching, and people are smiling, and they are talking about this campaign. This is one of the important this in Hasra and Bagalkot we have done in all the talukas. Next slide, sir. So, and as well, it's a replicable and a sustainable model actually. So we have started in 2016-17 in one district, and we have presented to the principal secretary health, and she instructed particular pilot rose campaign should start. Should be implemented in all the talukas. In Karnataka, we have 176 blocks. So she asked us to put this particular activity in the NTCP IEC program. And in the PIP also we have given the new activity, and Government of India and considered our this particular activity, and they have created fund for this campaign for the taluka level campaign since 2016-17 financial year. And over 10.50 lakhs people we have sensitized through this campaign, including students, parents, and people. So overall, it is very good IEC activity for educating on tobacco control program. Next, next slide, sir. So even Government of India, Ministry of Health and Welfare also appreciated this particular campaign, and it is also in the best practices document of Ministry of Health and Family Welfare, and it is a part of the PIP now. So we have started in one district, and now it is the part of the government program, the part of National Tobacco Control Program. That is the beauty. So my request to all the public health colleagues and professionals here, let us think out of the box. Let us try to do some innovations which is locally adoptable, feasible, and sustainable model. That is what we expect, because the tobacco control challenges in Karnataka is quite different from Punjab. So Punjab has its own challenges and difficulties in implementation of National Tobacco Control Program. So it requires locally tuned innovations for the improving the effectiveness or the impact of the program. It's either tobacco control or any other program, which requires impactful innovations and replicable innovation for getting a higher level of impact. And even one more the best part is Government of Karnataka is also considered this rose campaign for its year calendar 2018. In all the department offices, you could see the one page on the rose campaign, and I feel very proud about it, because a simple thought and which makes a lot of visibility, and that people are now aware about the Section 6B of Code Palm. And currently in Karnataka, so we are in a good situation in terms of TOFI implementation. And this month, 21st, we had a one online video conference under the chairmanship of Public Instruction Commissioner, and we have reached around 20,000 teachers through video conference. So, and we have done a survey in Udupi. I'm quoting the Udupi survey. They had only 1,200 plus 2,200 schools. Out of it, 1,752 schools and colleges voluntarily they stopped the sale. Point of sale, they have stopped it voluntarily without any enforcement. And few are they still started, they continued the sale. And for them, we have done the focused court by enforcement, right? And booked a case under Section 60. and media involvement on that particular Udupi program. More than 55 media people, the clips we have received on the next day. That's earned media. We have not paid for that, which means the media is very, very important in this issue because so we do lot of tobacco control activity. But sometimes if you are not sensitize the media in a good manner, they will write their own style. So it won't reach the people. That's why it is very important to sensitize the media about the, this particular tobacco control program, especially on the, stopping the new initiation of tobacco. That is very, very important for us. And we have conducted the focus enforcement drive on point of sales who are continued the sale in that particular district. And this is also gives an one more idea saying that under National Tobacco Control Program, every year we are supposed to do 48 enforcement drives in a district. That is a target under NTCP. Now we are instructing the district tobacco control cell, please conduct these 48 enforcement drive only on educational institution, only under section 6B violations, so that we will get the TOFI compliance. So if you do this particular drive according to your convenience, there is no use. That's why you please focus the CODPA enforcement drive strategically within the 100 yards of education institution, so that it gives a result for us. So these are the the key activity under the Rose campaign we have done, and and we felt that it is very effective and innovative to get the good compliance for Section 6B in the state of Karnataka. Over to Rakesh.
So thank you, Prabhakara ji, for a wonderful presentation. And it is very impactful and innovative idea to do this Rose campaign. And you told about the key features of the campaign, the single campaign that reaches multiple target groups, including students, youth, teachers, parents, law enforcement, tobacco sellers. So that is a very good thing about it. And it is very cost and time effective also. Since you are doing it as a one-day program, so it is very cost effective and time effective. And you involve media people also. So the activities they reached more people through media, and it was earned media. You did not pay a penny for this.
No.
So
No,
that is
no.
a good thing, yeah. Then you involved all the multi-stakeholders, including civil society, local political leaders, media to generate public awareness. So I think all the states and UTs can adopt this campaign. It is quite replicable, and all the states, I think, they will benefit from this campaign. Maybe some of the states have already adopted this program. And so mainly the strategies are to counter the tobacco industry interference and implement the COTPA very effectively through this campaign.
Yes.
So as we know that more than 13.5 people, lakh people, they die in India because of tobacco use. So that is quite a lot. And you could also effectively implement the TOFI guidelines in your area.
Yes.
So that is a good thing about it. So we have Mr. Rajiv Chaudhary from RCTC PGI. He is the project coordinator. So over to Mr. Rajiv Chaudhary. Rajiv Chaudhary, you can ask people if they have any queries.
Yes, sir. Thank you, sir. So I request the delegates. First of all, thanks to Prabhakara for this wonderful presentation.
Thank you, Rakesh.
Now I request the delegates and participants of this particular webinars, in case you have any questions, please unmute and ask the questions to Prabhakara then.
And we will have concluding remarks from Dr. Rakesh Gupta. Jaipur.
Yes, sir.
So before
Sure,
that,
sir.
we can have queries from others. They can
Yes,
unmute
sir.
themselves and just ask.
So I request the delegates.
You can put queries in chat box, or you can unmute yourself and ask yourself.
Yeah, in case you want to ask questions through chat, you can write in the chat. So we'll ask Prabhakara the same questions.
Prabhakara, I must say that it is a very, very simple presentation.
Yeah.
And I think everybody understood how it is to
Correct.
be done and
Correct.
how to adopt in their own states. It is very
Correct.
easily
Correct.
presented,
Correct.
very simply presented.
Yes, yes. Because as Dr. Rana sir always tells us, for tobacco control, you no need budget.
Yeah, yeah.
With us, without budget, also you can do wonders.
Yeah. In
Without
Punjab, we
one,
proved it actually.
yeah, exactly, exactly.
Because we
Yes,
never had any budget in Punjab.
exactly, exactly. So
Yeah.
some of the policy level, but we followed Punjab. For example, e-cigarette.
Yeah,
So
yeah.
the e-cigarette ban done by Punjab, and we referred Punjab success stories with the government of Karnataka, and then we second state we banned e-cigarette in 2016.
Yeah, yeah. Yeah.
So
We did it in 2013 and you did it in 2016, I think.
16, yeah, yeah. Why I'm quoting this particular example is similar kind of not only policy level, but similar kind of any IEC activities or any activity. You please study the best practice of any state
Yeah, yeah.
and try to understand it and customize according to your requirement.
Yeah.
That is very, very important.
It is always easier to get it implemented if it is
Exactly.
implemented in one state at least.
Exactly.
So
And
Rajiv,
yeah,
we can ask
Yes,
Dr. Rakesh Gupta for his comments. And in
yes,
between,
yes.
if anybody has a query, they can ask.
Sure, sir. So I request Dr. Rakesh Gupta, sir, from Rajasthan Cancer Foundation, sir. Please comment on this presentation also. And in case you want to ask anything to Prabhakara, please go ahead.
Okay. Thank you very much for this opportunity. I have a lot of admiration for Prabhakara for his commitment and hard work that he always does in implementing the tobacco control related policies. And this definitely is an innovative practice, which I'm sure had a good effect as we could see from the outcomes. And I always feel that doing such activities require a lot of determination and courage, because doing such activities in the field is always, it requires a lot of resources, time, and effort to reach out to all the stakeholders, engage them, and then do it on a particular day is always more difficult because of other situations or circumstances which these stakeholders may be facing at that on that day particularly. So getting a concurrence to do the activity on a day is not easy. So there's a lot of admiration for doing such a work. My only challenge is that, and Prabhakar, I want you to speak about it. Could you do the benchmark evaluation of to say that how effective this campaign has become so far as the tobacco prevalence goes in the age group of 13 to 15 or maybe 13 to 18, the secondary and higher secondary schools? And secondly, how many of the shopkeepers or retailers to whom these children had gone with the campaign, they could really make a shift? And how could they make a shift? Because the shops are very stationary places and cannot be shifted, even if it's not within 100 yards of the school's perimeter. How would the retailer shift his shop? Or why would he stop selling tobacco products if there are other merchants who are selling tobacco for retaining their customership? So these were some of the thoughts I have, and I wanted your clarification on this.
okay. So thanks for the question, sir. Motivation. Number one, the first question is you are talking about the why they have stopped.
Yeah, you can begin with that. Yeah.
Yeah,
Why
why
would
they
they
have
stop?
stopped? Yeah, because the point of sales, most of the point of sales, for example, I know about tobacco control. I know the tobacco affects the health. This kind of general level information is there with the most of the general public. So I know about yes, impacts on health. That is the only information they have. But if you dig into the depth of the issue, if you can talk with them at least 10 to 20 minutes closely about how this particular tobacco, help, suffering us, and how the one family, because of a cancer due to the tobacco consumption, how the one single family is suffering, and because of a 2 rupees or 3 rupees of margin, you are killing the your customer. So that point of sale owner is only keen about this margin, but he is not completely aware about how the tobacco consumption impacts on the family, impacts on the individual in his family life and his overall development of the person. So as I told in my presentation, the most of the point of sale owners are the relatives of the students of that particular area. So we told them, you please stop the sale of tobacco. No need of shifting your shops from this place to another place. You continue your sale of stationery or any bakery items, other things, but don't sell tobacco. That is the only message we have given to them. Our message is very clear and specific. You cannot sell tobacco within the 100 yards of educational institutions. We are not expecting you to go out from this 100 yards of education institution. We are not asking him to shift the shop from one place to another. We are not asking them. We are telling them, you cannot sell tobacco. Yes,
But
it is
what
is
if
going to, yeah, it's going to hit its profit, its revenue. We completely aware of that. But we are telling them, for the sake of revenue or the profit, you are killing the multiple people. We are killing your children, your own family members. This message which hit the point of seller, and we could motivate them to stop the sale. So you want to ask something?
Yeah, no, I was just thinking if you are telling it to a shopkeeper who is selling other goods also,
Yeah,
be making sense to him.
yeah.
But somebody who is a sole or exclusive tobacco vendor,
Huh.
how can you stop the sale of tobacco
Okay,
in that
you
area?
are right. If the seller is an exclusive tobacco seller, then he has to shift. I completely agree. But in terms of in case of Karnataka, if you see the COTPA studies, I'm audible. Am I audible?
Yes.
Yeah, yeah.
If you done the simple analysis of COTPA compliance of study conducted in Karnataka, more than 80% shops are selling tobacco and other non-tobacco products. They are not exclusive sellers. Only 15 to 20% are exclusive tobacco sellers. That too, there is Gadi shops. So most of them they are selling other tobacco products. They kept this tobacco, cigarette, or BD just as a part of their tea, coffee selling, not its exclusive one. So that's why these 80% of, or more than 85% of shops which are selling other than tobacco products, they stopped it because they don't have any much impact. But as you rightly pointed out, those who are selling exclusively, then they have to shift. For them, and these street vendors, especially the street vendors, we are having issue with the street vendors. Even today in Karnataka, we are suffering. We are finding difficulty, get the compliance, COTPA compliance with the street vendors. We are finding difficult to implement the tobacco vendor licensing with the street vendors. And as you are aware, in the earlier discussion with you also, in Karnataka, we have 314 urban local bodies. 314 urban local bodies. And we have initiated tobacco vendor license all the ULBs. But we have given the instruction. And in our SOP also, we have mentioned that in the initial stages, don't touch the street vendors. You try to motivate the permanent vendors. And then the vendors which are selling other tobacco other than non-tobacco products, so that you'll get the initial compliance of the vendors. Then later you touch the street vendors for the that street vendors, there will be a lot of local dynamics and politics. So that 15% are covered by the street vendors actually. They are still not able to, and we are not able to, implement the or enforce the quota with them because of the local politics.
So exactly how many have shifted? Can you give the numbers of the
Yeah,
people?
in the Udupi, as I told in my presentation, in Udupi district, one of the district, the first district where we did the rose campaign, we had around the 2,200 shops, I mean schools. Out of it, around the 1,752 schools, they are compliant with Section 6B after the rose campaign. It means in a 1 kilometer radius, we might had 5 to 6 shops, tobacco shops. So they have stopped because of the rose campaign. In that particular district, I have the data of the only UDP. I don't have the data for the districts they have conducted rose campaign. So I'm quoting only the UDP district study finding.
And naturally, this will also require a measure of the initiation of tobacco products by the school-going children. So that data will also be required here.
Exactly.
I'm sure you must be doing something about that as well.
Yeah. And if you see the Global Youth Tobacco Survey 2019, Karnataka is having 1.2% of prevalence among the age group of 13 to 15 years. The second lowest prevalence in the country after Himachal Pradesh. Am I audible, sir?
Yeah, you are audible.
Yes.
Yeah. So, in terms of new initiation of tobacco in the state of Karnataka is under control. With that institution, we are talking about the tobacco free generation 2030 policy. So which I discussed earlier, because we are already in a good state, and we have a good systems and mechanisms under National Tobacco Control Program in the state, and then the political commitment, bureaucratic commitments are too good. So that's why it's the right time to work on these points.
Thank you, Prabhakara.
Yeah.
So thank you, Dr. Rakesh Gupta, sir, for this important questions. To Prabhakara for giving a response to this. Any other questions by any of the participants? If you have any query regarding the presentations.
So Rajiv, if there are no more queries, I think we can proceed with the formal vote of thanks.
Yes, sir.
But
Yes, sir.
I must say that Prabhakar has done a very real good job, and it is very impactful campaign, I must say.
Yes, sir. So, Prabhakara, just a short question that this campaign is going on nowadays also. Yeah, it's a short-term campaign like that.
Till last financial year, it was part of the National Tobacco Control Program, IEC program.
Yes.
In the last PAP meeting, the MD asked us to not to give a specific fund for the IEC, for the fund for the rose campaign, but it can be done through quote per fine amount at the district level. The campaign is going on, but there is no allocated funds for this particular activity under the NTCP. But we are mobilizing the fund through quote per fine amount at the district level for this activity.
Okay, great. So thank you. So, Dr. Rakesh, sir, do I proceed with the closing then?
Yeah, we can have a snapshot. Some new people they join, so we can have a snapshot if they want, or you can proceed with the vote of thanks. Can you please open up your videos so that we can have a snapshot? Because some new people have joined.
Yes, everyone, please switch on your videos for some time. In the meantime, we can go with the vote of thanks for those. So thank you. First of all, thanks Dr. Rakesh, sir, for giving me this opportunity to propose vote of thanks. And thanks to the keynote speaker of today's Mr. Prabhakara who is working as a program manager with the state of Karnataka. So thank you, Dr. Prabhakara, for this wonderful presentation, because I hope this information you shared with the other delegates and participants from other states, they may plan a similar campaign at their levels. And in case they have any query or any concerns, they can contact directly either
My submission,
Prabhakara.
Rajiv, my
Yeah.
submission here is I can share the concept note of Rose campaign with you and Rakesh sir. You can share with anybody who wants to replicate this model.
Yeah, that will be great. I think you can
Great.
put it on the website also of RCTC.
Sure, sure. I'll share with you, Rajiv, by email.
Yeah,
by
with me also you can share.
yeah. Please.
It's great, I think, and all participants of this particular webinar, they got benefited by these informations. So thanks to Prabhakara again, and thanks to the delegates who joined. Thanks to Dr. Rakesh Gupta sir joining from Jaipur, and congratulations to the team Cypher, lead by Dr. Rakesh Gupta and Arun Verma sir, and the team of Eco India who is supporting us technically. Thanks for them also. And thanks to participants. Each one of you has a wonderful presence for this particular event, particular webinar. Thank you everyone, and have a nice day.
Thank you. Thank you so much for the opportunity.
Thank you. Thank you.
Thank you.